vaccines in the mosque the other day. So Karishma, do you want to talk about your efforts to get more vaccines in our community?
So the New South Wales Health is trying to expand the number of hubs and places where people can get vaccinated. So for those of us in the Southwest, there's a new vaccination hub at Macquarie Fields, which is hopefully close to, especially those of us from Edmonton Park. And there's also partnerships being formed with other organisations to try and vaccinate more people. So Kanmani Auntie, there's a vaccination hub at the Glenwood Gurdwara,
okay.
temple.
Yeah, I'll tell them. Yeah.
Yeah. So you can get vaccinated there, and we're hoping to have a vaccination hub at the Ram Temple in Austral as well. So there's a few hubs at councils, community centres in Liverpool and Cumberland as well. So if you have any questions about where your local vaccination hub might be or where else you can get it, because I think even today I've heard from a couple of people that those who are going to Olympic Park are waiting for long periods of time in line. So it might help if there's somewhere closer and somewhere that's, that you don't have to wait as long to make that process a bit smoother.
Yeah. So yes, please ask questions. I mean, there's of course questions about how we're going to manage another month of homeschooling and working from home, and how we're going to manage, if you have family members going back to school. How do you feel about that? Any questions, comments?
Yes. So let me ask you a question in relation to the vaccine itself. So in our house, all of us above 40 have been vaccinated, like including my mom, myself, and my wife. We all got, myself and my wife got Pfizer, and my mom got AstraZeneca. We have a daughter who's about 20 years old. And, following the news and advice from the government, it's been changing for a while, right? So initially we were said they made a AstraZeneca was considered not so safe for people under 40. Now today's advice came out. The premier was saying anybody over 18 can have either vaccine, and it's not very clear. I mean, it's it doesn't provide a comfort feeling whether to or not. To give AstraZeneca, because Pfizer, I was looking for Pfizer. It seems that there's a pretty good demand for it right now, and if I wanted to get my daughter vaccinated with Pfizer, it's still a few months away. So what's the advice on the AstraZeneca?
So this is a discussion I have every day, and I'll start by saying I had the AstraZeneca vaccine myself, and I am in the 40-year-old age group as well, and I was perfectly fine. And a lot of my friends who are about the same age as me had a lot of medicos have had AstraZeneca, and they're okay. So the issue is we have to look at, it is a numbers game. If you look at the risk of death with COVID, it's 1 in 300. So it's a lot higher than the risk of death with this rare, I think it's thrombocytopenic syndrome with AstraZeneca. It's looking at the chance of dying from it is 1 in a million, okay? 1 in a million chance. And the chance of getting it itself, it depends on the age group. So we're looking at 4 in 100,000. So again, very rare risk compared to dying from COVID, because even as you would know, there was a young lady who was 38 who passed away of COVID with no comorbidities. That's the virulent Delta strain. So the more and more research are coming out that AstraZeneca and Pfizer are pretty good at A, preventing hospitalization, and B, severe disease, because that's what we want. At the end of the day, we want a vaccination. Yes, it's not going to completely prevent the infection. So you will still get the infection again. And yes, you can pass it on, but you're not going to die from it, and you're not going to end up in hospital with it. That's the key. And that's what in UK, majority of people have been vaccinated with the AZ. And as you can see, they're opening up. So the cases are going up, particularly in the not vaccinated. And it's the same thing happening in US. So it's a pandemic now for the unvaccinated. So the key is vaccination. So the rate, I don't have the figures. There were three people who died, or a few more people have died of AstraZeneca, and they're all in the older age group. Granted, they're the ones who received the vaccine, but compare that to the number of people dying. Like if you look at the Indian cohort, there were a lot of young people dying of the Delta strain. And India is a good test for AZ, because AZ is, I think, marketed as Covishield. It's made in India. And a lot of Indians have received that, and they have tolerated pretty well. So that's how I would go by it, that it's a rare risk. So it's much more, it's riskier to get in the car than to have the AstraZeneca vaccine. And we get in the car without thinking every day, getting the car and having an accident. That's what I'm trying to say. So in a sense, I think the AstraZeneca is safe, but that small amount of risk which we take, and we take those risks every day in a lot of things that we do. I hope I answered that question.
Yeah, so yeah, it does, and that's been some of the I've been reading about it as well, so it's quite consistent with what you just said as well. So yeah, thanks for your response to that.
And I must say, AstraZeneca has been, I guess, has become the villain in the piece, because the medical fraternity has not been on the same levels. There have been a lot of doctors who have advocated against it, which has made it more of an issue. And there's also been, I guess, the chief health officer who said, I don't want 18-year-olds dying of AstraZeneca vaccine, which does not help. It would, I think that's, and I'm having, huge conversations with my family in Melbourne who are, very upset at AstraZeneca being pushed down the throat because they think it's a deadly vaccine. And so it's this, it's we are in damage control, unfortunately, but in the situation we are at, there is evidence that we can vaccinate, we can reach the target much faster if everyone opted for the AZ of Pfizer. So so the choice is, if you want to get out of lockdown faster, then, and if we can get to either vaccine, whichever vaccine you get to faster, that's the way to look at it.
Yeah, absolutely.
Officer, she's actually got the AZ vaccine. She actually said that, I think this week when they had the 11 o'clock press conference, she did say that she and her husband and her mother-in-law did get the AZ vaccine.
Who was this?
Kerry Kent.
Oh, yeah. No, I think even Gladys got the AZ vaccine. So a lot of people were, I think the Prime Minister got the Pfizer, but Gladys got, I should say Miss, but Jacqueline, I don't know why we all call her Gladys, got the AZ. And a lot of, I personally had, because I was giving AZ to my patients. So I got the vaccine first before I gave it to my patients, because I told them I've had it. And they would say, but you're young, first started with the 90-year-old patients, and like, you're young, you'll be fine. And
I think there was a lot of discussion regarding blood clotting with the AZ vaccine, which is why I understand when Neil said that he's concerned to get the AZ. Who did you want to? Who were you saying regarding the vaccine? Because I thought you all got the vaccine, right?
Yeah, so most of us over 40 at home, we all got vaccinated, but it's for my daughter.
Oh, for your daughter, yeah.
Pfizer is a few months away. If we have to wait, but if AstraZeneca is available, so based on everything I've heard, more than a concern, it was just a question, whether to go ahead or not. And you're right. I mean, the government messaging around the vaccine has been pretty pathetic, to say the least. I mean, we could have been in a much better situation months ago. We shouldn't have been in this position right now if only they had sold AstraZeneca. AstraZeneca particularly, they made it very clear they're not going to make profit out of this, whereas contrary, Pfizer has been making huge profits, breaking up the prices, and it's worked in their favor. Which is a sad thing.
It is. And there is an element, sorry, Karishma.
I was just going to say, just in relation to your daughter's situation. So I'm under 35. I have an underlying condition. So I have type 1 diabetes. And for me, the risk of, suffering the ill effects of COVID is much, much worse and much higher than having the AstraZeneca. So I've personally had both doses of the AstraZeneca.
Ah, nice.
Yeah.
And did you have any after effects at all, Charishma?
I had a sore arm and was feeling a little bit under the weather for a couple of days afterwards. But apart from that, which, you know, I normally get with
That's
the flu
normal.
vaccine
Yeah, that's
anyway.
what. Yeah.
Normal.
Okay. Perfect.
Normal.
And
Just,
lovely.
sorry?
Charishma, you can be a poster girl for anyone who has
Poster
any.
girl.
She is, she's going to be.
But just to add to what Vani said, absolutely, and I think we have very quickly reached, and what Neil said as well, belatedly, but we have very quickly reached a situation where really the only way back to semblance of normality is through vaccination for the majority of us. But I think more importantly, while you know, thankfully here, I think some of us are yet to know people who've been affected by COVID in Sydney. I think all of us are well aware of our close family and friends that have been affected by it back in India. And the reason why I sort of want to bring that up is because in quite a large number of groups in Southwest Sydney, where I work, where I see every day I'm on call, and I've got quite a few calls from different hospitals, Campbelltown, Liverpool, and Bankstown, that the number of people coming in at different stages and different phases of the illness, you know, continues unrelentingly. So that is happening day in and day out. And yes, the lockdown is having an impact in terms of limiting its spread, but there will be one day when lockdown is going to be lifted. As much as I would like, I'm not confident at this stage that that we're going to completely stamp out community transmission. So it is likely that there will be a level of the virus in the community. And I think the best protection all of us can give ourselves is to get the vaccine. Clearly, you know, the people that are in the ICU, the people that are on ventilators, all of them are those that haven't been vaccinated. And so clearly worldwide, in India as well, in the UK, everywhere, AstraZeneca is equally effective as compared to most other vaccines. So really a very, very strong message from here is that the community transmission is rampant. If and when lockdown lifts, we are all going to have some level of exposure to the virus. And so it's our duty to protect ourselves and protect our near and dear ones. So really there is no doubt that we should get vaccinated, because otherwise we're going to continue to be in the state that we are in indefinitely.
Rajiv, just a question on that. Vijish has posted in the chat, is it airborne? Vani or Rajiv, do you want to answer that?
Vani, you can have a go. I mean, I can say, but I think Vani should have a go.
Yeah, thanks, Raji. Yes, so initially it started off being droplets. So there was the issue of masks to begin with. So initially the advice was masks wasn't a good idea, because what we didn't want to do was touch surfaces of things and then touch our face, which is what we would do if you were wearing a mask. But then as with the quarantine system, it was getting more and more evident in the hotel quarantine, which is not devised for, you know, protecting airborne disease, that the air condition went more or less spread the COVID through the quarantine hotels. And so that's when the advice changed, I think about August or July last year, where masks, you know, I was wearing masks until, I basically didn't stop wearing masks since August last year till now. Is that your understanding too, Rajiv?
No, yes, absolutely. I think that was also something that came up in India at the height of its second wave as well. I think the question is, can the virus survive without a host, and can it survive in the air for, you know, a considerable period of time? So if I have walked in a particular area or been in a particular room and I have coughed and I have COVID, is that going to linger in the air, waiting to then, you know, an hour later or half an hour later, latch onto someone else that comes into the room and then infect that person? Clearly, I don't think, while transmissibility is pretty high, I don't think there's any evidence of that. The fact that it can be alive without a host, or that it can be in the air for extended periods of time.
I think Rajiv, I think it can be there for about 15 minutes, if that's correct.
Yes. But it's not for hours and hours. And
no, correct.
And clearly, it needs to latch on to go from you onto somebody. Yes, within a period of time. I think 15 is probably the maximum.
I've just noticed that Vinoji has had his hand up for a little while. Did you want to ask your question or make a comment? Vinod?
Actually, I did my hands up to show that I've been vaccinated.
Oh, okay, sorry.
Hey.
Yeah, thank you. Yeah.
No, oh good.
Another thing I wanted to ask the question, I think I sent it to the HBN group. I was speaking to one of my personal trainers, and she asked us all these questions. Said it affects fertility, women get cancer, and some ED nurses spreading the thing that the government is actually not giving out all the details of complications, and they're actually much worse than what is published. Now the question is going to be, are we going to, we should probably address it, because where are they getting these messages from?
Social media. Because it's...
There may be a way, there should be a way, isn't it, that you should regulate, like, how India's trying to do for Twitter.
There is, as you saw, the protesters on Saturday, there is a group of Australians who do not believe this is happening. They think, actually, I saw such a patient on Friday. She came into the clinic against advice from the reception not to come in, let the GP call you first, then come in, and then proceeded to tell all the people who are coming to vaccinate not to get vaccinated. So there are people like this. And unfortunately, I have talked to many of them trying to figure out where they're getting there. WhatsApp, Facebook, YouTube. And many of these people who say these things are supposedly doctors in elsewhere, and they say that it's like flu. That's another common theme, that it doesn't kill as many people. I think Alan Jones was saying something to that effect. And I have a lot of patients who listen to Alan Jones. So I have to,
60 plus, 70 plus group.
Yeah. This was like initially with the vaccine, I had to convince my patient that Alan Jones is not a medical expert and probably should listen to me a bit more than that. And she did. And she was very grateful she was vaccinated because we had that chat. But there's a lot of this.
The question is this, yes, we're going to get that from the social media for sure. Is there any way we can address it? Like, grab a bunch of questions or people who want to ask questions, run a, like a talk show or something, and say, these are why these are wrong.
I think that was one of the intentions of this forum as well, because we were noticing that there was a lot of misinformation, not just about the health effects, but also some of the restrictions and the, the regulations in place. So, for example, in the last few weeks, I've had messages that look like New South Wales health orders saying that New South Wales police will be COVID testing people in their cars. They can't do that. No New South Wales police person is going around doing COVID tests when they, pull people over in their cars. And also that all supermarkets would be closed from last Monday. Again, not true, not factual, but there are actually people deliberately propagating some of this information by making it look official as well. So this is one of the ways that we can do that. I guess also when we come across false information, telling the person that shared it with us and saying, this is actually not true, can you not share it? Or, please, please delete this or whatever it might be. Because it's important that we call out the people sharing this information. Usually in good faith, they think that they're, spreading information that is accurate.
But it's quite difficult to know which, like there's that, phase. Some people you can talk to, they are in the contemplative phase that they don't know if this is true or not. And then there's a group of people who are just going to, so it's very hard to discern who's the person and who you need to expend that energy, because your energy is finite. That's the important thing. I think Rajiv's asking a question.
No, just to sort of add to what Prashant has asked, and I think he mentioned a very, very pertinent point, and this is something that I'm getting from a lot of my patients and their families and so on and so forth as well. And there've been many, many different, very interesting reasons given. Some of them have said they'll never ever get tested because it means that the government will have a piece of their DNA to use for whatever other purpose, so they won't do that. There are several others that sort of speak about not getting the vaccine because it means, somehow they're going to be microchipped or in some ways, there's a significant conspiracy. And so these are some of the more colorful kind of explanations, but there are many, many reasons people give. And we spoke about sort of vaccines, causing rare conditions. I've seen many instances where testing has caused quite a lot of difficulties as well. So I've seen a few patients, in fact, unfortunately, a couple of my patients as well, who needed to get tested. And because I see a cohort who doesn't sit still, that the probe actually broke when the testing was happening. And they had to be admitted to hospital and taken to the theater under general anesthesia for that to be removed by a specialist ENT surgeon. And for some of them, they continue to have difficulties, till today. So nothing that we do is without a level of complication and without a level of risk. And I think these kind of questions were asked last week as well, and I'm very glad that they're coming up again. But yes, we will address all of those kinds of things. But we just have to, I guess, accept that there is a population, irrespective of what we say, is just not going to get convinced to either get tested or to get vaccinated. I think we're moving, and today's. Yeah.
Sorry, Rajiv. No, acceptance, I agree, and I think doing it, on an individual basis is fantastic. But those are the people who are coming forward with the questions, correct? Now, how about those patients who don't come forward to you? And the next question is going to be, people who are, educated, they can ask questions, in the right language and get right answers. But what about the people who are getting these messages in their own language, and they probably are not even looking at the English, media? How are we going to address them? That's another question.
Yes, and as Charishma said, this is a good beginning. And I suppose here, at the moment they're 31, we were up to 35, 34, I think at one stage. If all of us, endeavor to speak to a number of people in our own groups, and that explodes and continues, I think one day we'll be able to achieve as much literacy as possible. There are certain populations, certain groups, certain subgroups that are more keen or less keen. Ones that we need to convince to get on board. But really, evidence worldwide has shown us that unfortunately there is really no other way out. At least at this stage, there is no cure that we know of that can be said with absolute certainty. That yep, don't worry, you've got COVID. Here is the medication. Here's the antiviral that will absolutely, definitely cure you, no matter what stage you're at. We don't have that. So until we don't have that, and so therefore, really we're very, very limited, using these blunt instruments of a lockdown. Clearly, is in no one's benefit. I don't think anyone really enjoys it anymore. It was novel last year when we all thought, oh, fantastic! This is the first time we're spending time with family, getting to go out on walks and so on and so forth. But I guess ultimately it's going to bite, and it's biting. For a lot of people who are daily wage earners.
Just on that, I wanted to go back to the of the question that people answered at the beginning of our conversation today. So I'm just going to share the results. So this was in response to the question, how are you feeling at the moment? Can everyone see that? So as Rajiv, yeah. So as Rajiv mentioned, bored and frustrated are feeling featuring very highly, and demotivated is featuring there as well. So I guess this I'm going to stop sharing so I can see everyone's faces as well. Who else kind of, yeah, who else resonates with those descriptions of lockdown at the moment? Hold on, I can't.
Charishma, I think I do, but I mean, I'm still working, which means the person who's actually suffering is my wife and my kids.
Yeah. That's balancing some of those commitments, I think, is also one of the things that people seem to have highlighted there. So fed up seems to have come up a little bit, and unfit. Anyone else want to add anything in terms of how they're experiencing lockdown at the moment?
Hello, Charishma. Recently, I mean, this is my family is doing okay, it's homeschooling, and all of us are working, so that's all right. But recently, I've received a call from another person who's been socially helping as well about people who are currently like, the person that was mentioned was both son and father are in security work, but with this lockdown, they don't have a job, and they're trying to get some assistance as well. So I think it's more on the food drive and things like that.
Yeah.
In the area. I think that's something that could probably assist in for some people.
Definitely. So knowing ways to access those services, yeah. That's definitely a huge concern at the moment. Can anyone else, you know, has anyone heard of similar situations like that where the biggest need is more on that services side? I know EDMA, which is the Edmonton Park Malayali Association, is looking at supporting people who are in need at the moment. Does anyone from EDMA want to just talk about that initiative? Rose, I'll call on you.
I'm just a part of, as I'm just a member. I don't know. Vijish and Ashati are there. Yeah,
hi,
Charishma.
Oh, hi.
Hi, everyone. So basically, EDMA is a Malayali-based community, but we are looking forward to helping the needy and also checking on the mental well-being of our fellow, fellow human beings, fellow neighbors. So what we're trying to do is set up a system where we have a few volunteers come forward. Say, for example, if someone is in need, we can do some delivery of their, essential goods, but always adhering to the current restrictions in place. So basically, that's the key motive, to help the ones in need. So I would share you the link to join the WhatsApp group if anyone is keen to come as a volunteer. But the word is not out yet, as in we haven't reached out to the major public as yet, because we do not know whether we have some restrictions in place in reaching out. So that's why we checked on with Charisma for her guidance as well. So basically, coming forward together as a community, being that oneness, bringing that oneness, and reaching out to the people that needs a hand. That's what we are aiming for.
That's fantastic. That's definitely much needed at the moment. I think Rajiv, you were mentioning that I guess the financial impact of lockdown and restrictions is biting a lot of people.
It's more like a time bomb ticking into inequality, because I'm one of the fortunate ones that I can work from home. I'm not much affected, but at the same time, I know a few people who work for daily wages, who run businesses. So they I don't know if government can still support them in terms of boosting the economy for a longer term, but we may need to come with a balanced system. So perhaps once the vaccination has been rolled out, we get back to our maybe not the correct normal, but at least much more balanced.
There's a few programs or initiatives that federal, state, and also local. Also, Liverpool Council, we just passed some financial support for businesses and people impacted by the restrictions. So, you know, for example, people experiencing hardship can apply for reduction on their rates, their council rates. So those sorts of things will be, it would be helpful to get that information out into the community so that those who need to access that can. Rajiv, you have your hand up.
Oh no, just very quickly wanted to make an observation that we're also moving. I think we're moving to a phase where those who are vaccinated will have access to a number of sort of privileges which the non-vaccinated won't. So they very quickly be moving to a world where yes, the you know, what you can and can't do will depend on whether you're vaccinated or not. So I'm sounding a bit crude, but ultimately, I think that's the new class war that's coming in a few months.
Mm.
And I'm also wondering about the booster shots. I'm sorry. Go on, please.
No, my question was, why is the government still waiting to let people vaccinated go out, right? Are they still not confident about it? Like we've got, you know, I think close to 11% of the population vaccinated with 2 doses, right? This may be encouraging for others to come forward. Is that because it's their own failure to not procure enough vaccines is the reason why they're not letting vaccinated people go out and, you know, attend venues and stuff? Or what is the reason why they can't do it right now?
They can't, at the moment, even if you're vaccinated, you can still pass on the disease. Like you can still pass on the infection. So that's the thing. Right. And then with only 10% vaccinated, you're more likely to, and more people can die at the moment. So that's why at 70 to 80%, it's less of a chance. But even then, as you know, there is a risk to the unvaccinated, but at the moment, the proportion is just too great to let us roam free.
Yeah, and that's right. The thing is, yes, Vani, no health system in the world is ever built to withstand a pandemic. So if transmission happens at a significant community pace, then very, very quickly our ICU beds will be full, our hospitals will be full, and the scenes that we have seen in India and in Indonesia and everywhere else in the world, in America, in the UK, at the height of their waves, will be replicated in Australia as well. The system doesn't have that. We don't have enough beds.
Just going back to some of the impacts of the lockdown and restrictions at the moment, I know quite a few people were interested in hearing a little bit more about how we can support young people who are schooling, especially the Year 12s who are going back to face-to-face learning in about a week's time. So I thought I would just introduce Danya. So Danya is a student support officer at a school in Southwest Sydney. And I thought it would be good if you wanted to just quickly maybe talk about some of the ways that parents can support their young people who are online schooling at the moment or in that transition into going back to face-to-face for Year 12.
Thank you. Hi everyone, I'm Danya. So I work at a high school as a student support officer. And during this period of time when children are doing online learning, I think it's really important for parents to check in with them just to see how they're coping with the level of schoolwork that they're receiving. Because a lot of the times with the children that I've interacted with, they are feeling quite overwhelmed with the level of schoolwork they are receiving. So one thing I would advise is for you to check in with your child just to see how they're coping. If they're having any difficulties coping with the level of schoolwork, they can always turn to their teachers. And you can even contact your child's teachers just to see how they're going with online learning. Another thing that kids need to be motivated to do is to ensure that they manage their routine. So for them to keep a structured routine where they are eating 3 meals a day, where they're exercising regularly, and where they are sleeping for at least 8 hours a day. Because when we are learning from home, we do tend to let our routine slide, and that can really take a toll on physical and mental health. So if you could ensure that they are following a normal school routine. There are plenty of in-school supports that they can access. They can access the support of their teachers, their year advisors. There's a teaching and learning team that can help them with all aspects of learning. There's the wellbeing team, which includes the head teacher of welfare, student support officer, and school counselling services are also running at this period of time. So if you feel like your child does need extra wellbeing support, there's plenty of supports they can turn to.
Thank you, Danya. Does anyone have questions about some of the things that Danya has mentioned? Vani, I saw your hand go up.
Yeah, my hand went up because I'm working at the moment. So my kids are being homeschooled at their grandfather's house. And so it's very hard to work and homeschool. I can check that they've completed some work. The teacher does call them directly, which is preferable to calling me because I won't know what they're up to anyway. So I'm taking the approach of this year as a write-off. And because, you know, it is very hard on them. They're not seeing their friends and so on. Is the school also being lenient towards the students? I mean, my sons are in year 7 and year 5, so it's not a big deal, I find. It's a different thing for year 12, of course. Are the schools taking that approach? Are they still going on as business as usual?
I think a lot of schools are mindful of the fact that students' well-being and mental health is really impacted. Like you mentioned, they're not seeing their friends. The situation is beyond their control. And I find that students are faced with a lot more workload, and maybe it's because teachers are unable to assess how much work should be given. But there's lots of schools that are conducting wellbeing check-ins with students. So teachers are calling, year advisors are calling students just to check in on their wellbeing. So I think schools are a bit more lenient and they are a lot more considerate about where students are at the moment.
Good.
That's good to hear.
I have a question for Danya. Hi, Danya.
Hi.
I wanted to ask, you know how my brother's kids back home in India, they're learning from home, like here. But what they're doing is they have that Google Classroom. So the teacher come into the classroom and she teaches the schedule or whatever it's scheduled for that day. But here it's like remote learning means they just give the task and that's it. The kids don't see their teachers, at least in my daughter's school. She's in year 8. She's screaming behind me. So what is happening is like some of the teachers are coming on Zoom now in this second wave. First wave, they all disappeared anyway. Second wave, some of the teachers are coming. But then how do they have how they're going to have the interface between the teacher and the kids? Most of the teachers are just giving the work. And why is that? Like, why can't they do that Google Classroom or some kind of a face-to-face, not in person, but virtually?
Unfortunately, I don't know the answer to that. It is dependent on the school that your child is at.
And Kanmani Auntie, do you want to?
Yes, yeah. I'm a high school teacher. In our school, we just provide them online, weekly homework for juniors. But year 11 and 12, we have normal lessons happening. And we have a regular timetable, like school timetable at home, they have to follow. And so when you have year 12 have maths this time, then there'll be a teacher teaching them and the other teachers will be supporting them and stuff like that. And now last week, we started having live lesson with the juniors as well. And we just talked to them about how they are going with the work. Do they have any problem with the work? I mean, whether they can do the work or they have, the welfare being checked on and stuff like that. So we just have online lessons, actually live lesson each week, once a week with juniors. But seniors, we have regular timetable lessons happening. And we just ask them to do the homework. And, we have the Canvas program. So they have to submit the work. So that way we can check what's going on. And we provide them videos and stuff. We just give them an opportunity to ask questions during the live lesson. Yeah, it's happening.
So that the checking of the work and everything is happening back in the background. But what about there's no evidence, like they don't send us anything or they don't email us or anything saying
No. school we are doing, because we just post everything on Canvas. It tells them what to do for each week. We give them at the beginning of the week. By end of like Friday period, 3 o'clock, they have to submit the work. We just give them only 3 lessons, even though we have 4 to 5 lessons a week. We don't want to do, for them to do the work after 3 o'clock. We just tell them do during lesson time, just as if you like, you go to school, you get up and log into each lesson. When they have science, they log into their science class. When they have math, they log into their class and stuff. We have a systematic approach in our school. I'm working at Cherrybrook Technology High School.
Okay. That's what I was about to ask. What school is this?
Yeah.
My daughter is going to All Saints. Because and there is no time limit, which is I think good enough, because they're at home, they can complete their work whenever, like in the day's time, like in a day they can finish their work given to them. But then whenever the teachers are sending the work, they send the YouTube links. So is that correct? Like they send the YouTube.
We do YouTube link, and we have like so much technology in our school, so they just have all those things already trained, tuned, and everything. So they know way to access work and stuff. But we still see them, like I saw them last week. All my classes, junior classes.
Okay.
Yeah, we just like make it a point once a week we see them. But we ask them whether they have any questions we could help them with, and they can send emails to us all the time. We send the solutions because I'm a math teacher. So we send solutions and stuff to kids. We just communicate so much. Yeah.
Yeah, which is good. In her school, that's not happening. Last year, I sent a teacher a question. Till today, she hasn't replied.
No. Our school is so great. We get so many emails from parents. The students also communicate. If they don't get anything, immediately they shoot an email, and we have to respond to it. And we are like, full on. Yeah. I miss my students, to be honest. I don't want to be at home, because considering I'm alone at home, my husband went to India, got stuck there. Yeah. My kids are one in Melbourne, one in New Zealand. I'm on my own. So, yeah. Yeah.
Thank you.
Okay, thank you. Yeah.
Rupa, do you have a question as well?
No, I just wanted to add on to what Rajni has just added. Yes, those are my woes as well, Rajni. I agree with you. I do have a problem. I think I've been trying to give some feedback to the school about what they can do, because there were some feedback forms that were coming through, and my suggestion was basically to have a time where they check in on the child, not necessarily ask each child, how are you doing, what are you doing, but more to sort of have a timetable check-in time with the students, so that there is a structure. Because I think what is happening with homeschooling is the lack of structure for the day. And they may do it till night, but then the amount of conflict it generates in the family between the parent and the child to get any task done is quite humongous. And I'm part of that, experienced it too.
Is that Pranav laughing next to
you? Wait, no, it's not me. It's I'm hoping it's not him, but I don't know what happens upstairs. I'm talking about the younger children, especially, because I think that's something that you can try to give some feedback to school and see if they can operate a system. And I'm still working on that task.
When the first wave happened here, and I was thinking, because like probably we are not used to do all these kind of things. So that's why the schools are not ready to go online. Like how India, immediately they went on a Google team and the Google Classroom, and they started their lessons on it. So that's what I was thinking. But when the second wave came, and when the news came that the schools are online, I thought they would be prepared for this. But the same thing, doesn't look like they're prepared for anything. At least the schools.
I think it very much depends on the school, because I run sort of external, as an external presenter, I run workshops or programs in schools. And like for the last 3 weeks, I've been running a program via Google Classroom, which it's tough because it's usually a very hands-on kind of program. But that's been through Google Classroom and having that capacity to see the participants face to face.
I might just add on to that. My two sons, as I said, one is in year 7 and one is in year 5. So year 7, like Kanmani said, that they are very, high schools are very organized. They have lessons regularly, either via Google conference
We have
or
team meetings as well. My Teams meetings.
Yeah. Well, my son's school, they don't use Teams. They use Google Conference
Oh.
or Zoom, and they use Canvas to submit. So I can tell what he's submitted and what he has not submitted.
Yeah.
He tells me he does his work, and it doesn't go into. He goes, "Oh, I forgot to submit it." So it's just that constant reminder. And whereas my younger son was in small, like it's just Google Classroom, and they have to do 5 activities, and it's done by 12:30. So after that, they're quite free. So I think what I might add to the parents is you have work to do as well. You can't be their teacher as well. Sometimes
No. We don't expect that. Yeah, we don't expect
so I
that.
think.
So that's why we put them like a timetable so that the students can just occupy that time, and then evening they have free time. So that way the parents don't need to worry about it as well. Just tell them what to do and stuff. Yeah.
And that's assuming the child is self-directed. My children are not self-directed at all. I don't know about other parents here. So I think understanding that this is hard and taking it easy, like, focus on your work, because that you can control. Your children's teaching is beyond your control. We do the best you can. That's all we can do. Otherwise, as it is, the stress is just multiplying on all fronts. That's the approach I've taken. It works very well for me. That's all.
And the students are already stressed because they are not seeing their friends. One of my students yesterday told me, "How is it going?" And he said, "Miss, I cried." I didn't understand. He said something like that. "I cried and cried and I slept and I came to class." And I didn't understand. I said, "What are you talking about?" "I cried." And I said, "Why?" "Lockdown extended. So nobody wants to stay home, and then the parents also put pressure. It's going to give them really like hard time. So, we have to take it easy. Of course, students are these days responsible enough as well. Yeah, because we were like last year, we tried so many things and we know what to do. And we started continuing this even on regular, schooling. We started asking them to submit their homework and stuff. So it is a practice for them now. In our school, we train them well. So that's why we are having really good time. We have everything organized. Yeah. I think the timetable would help because the students know what to do, when to do. We always need structured, kind of timeline. For even us, we need a structured thing. If you have too much time in your hand, I don't think we'll do things properly. That's my idea. Yeah. Thank you. Yeah.
I saw a post. Firstly, Danya has to head off, but thank you so much for joining us today. We'll see you next time, hopefully. And I also saw that Shashianti made a comment about your daughter being assigned work through MS Teams. Is that right?
Team?
Yeah, I was just looking at your comment, sorry.
No, we just put them in Canvas, but we have meetings in Teams meetings on live lesson. We get to see the whole class, and we talk to them and we ask them their opinions and how they are going, if they have any questions they can ask, and how they are coping at home with the school and homework and, being at home. Yeah.
I think the big message seems to be that different schools have different platforms.
Yes, how they have organized, because
apart from the studies,
have the
it's
technology to do that as well.
Sorry. Apart from the studies, it's hard for me to motivate my daughter to do some exercise. At least go out and see the sun. Sun is not coming to her, so at least go and see the sun. So how can I do that? I'm just asking a common question to everyone, I guess.
What's the average device usage for the children?
Sorry?
Device, what is the hours? I'm sure there's an hours. Nobody wants to talk about it. Yes.
Hours. So that's my problem. What happens is when the school sends a work, it's on YouTube. Like some of them, teachers ask them to refer to YouTube. And whenever I go in, she's on different kind of a YouTube, and she keeps saying, "Oh, I just changed now." So it's very hard. Like at least teachers shouldn't give any work on YouTube. Like go and refer to YouTube. So I think that would be good. I'm not sure what it is. And they have twice
next week.
Oh, sorry.
Sorry, Charishma.
Sorry, no, I was just saying it's very timely that you
Yes.
you mentioned that, because next week's session at the same time as this is about stress, how it works, how we can, what sort of strategies we can use and that sort of thing. So that would be beneficial not only for the parents here who are trying to keep on top of working from home and online schooling and everything, but also for young people who are struggling with the online schooling. So thank you, Rose, for joining us as well. But hopefully we'll see you next week at the stress session. But sorry, Auntie, what you were saying something?
No. In our school, when we put the timetable, we give them in between two lessons, 10 minutes, 20 minutes, so that they can go for a walk. They have to be away from the screen. And that's why we don't give them any work after 3 o'clock away from screen. Just have them free time and stuff. Yeah. We just have plans in such a way that they have to go for a walk. We always tell them, go for a walk. After this lesson, go for a walk. Before the lesson, did you go for a walk? Yeah. We just insist on that as well. Yeah.
I wish my daughter was in your school.
We are really organized actually in our school. Yeah. I'm really, delighted to be there. Yeah. It's a very nice school. Yeah. Okay. Thanks for talking to you guys. See you maybe next week. Yeah. Same time, Karishma?
Yep. Same time as this one. So
send the link again or the same link?
So we'll send around the link. I'll send you the link, Auntie.
Okay. No worries. Thank you.
Anyone else have,
yeah.
Thanks, Kanwini. Does anyone else have any final thoughts or things that they want to share before we come back together next week?
I think that there was one from Kriti. There's a message in the chat.
Oh, let me. Oh yes, Kriti, did you want to share that with?
No. What I just wanted to tell, I think it's become more of screen time for all the kiddos. I think it's an opportunity for them for the more of screen time. It's very difficult to avoid, kind of thing. And as Rupa mentioned, with the younger kids, it's giving a very hard time. For the homeschooling, it's though, especially for the kindergarten and stuff. Yeah, that's what I just conveyed. That's it. Yeah.
Yeah, especially when they're not able to get the same level of physical activity.
Yeah, when they don't know what is homeschooling, and of course, that's kind of thing.
Yeah, definitely. Well, thank you everyone for joining us today. I think I personally got a lot out of this conversation, so I hope you all have as well. As I said, next week, same time, 4 to 5 p.m, we'll be hosting a discussion about stress and well-being. We'll have Dr. Vani on the panel again. Do you want to just say a few words about the panel next week, Vani? I think you're on mute.
Yeah. So next week we'll have a clinical psychologist and a GP, another GP with mental health expertise as well. So, and myself, and we're just going to go through what stress is, the neuroscience behind it, how we feel it, and what we can do about it. And you'll have plenty of opportunities to ask questions. So that'll be great.
Excellent. So I will circulate the link to register for that if you haven't already. I will post it in the chat very shortly. Just give me 1 second. Sorry, do you guys want to chat while I'm finding this link?
Yeah, no. About next week, so that's the third of our formal series. So I think a number of you would have attended the first two. So the first one was on cardiovascular health, and the second one was on diabetes. We had a very rich panel discussion. And next week will be a little novel experience because the panelists unfortunately cannot be together because of the current New South Wales rules. So they'll be in their different places and then joining remotely, but it'll still be as effective. It'll be on Zoom, and Charishma has just posted the link. And many thanks for all of you who have already registered. You've made a number of comments and asked questions, and the panelists have already incorporated all of those into their presentation. And over the next week, you'll have more opportunity to register and ask questions. It's very, very timely. in terms of what all of us are going through. I'm sorry we didn't have enough time to discuss about the point that Kriti raised in terms of increasing screen time for children. So perhaps, Vani, if you have time in the next week's thing, we can incorporate that into it.
Yes, I will.
As one of the questions, and see what yourself, Jesse, and perhaps Saroja may have in terms in sort of responding to that, because I think that's a very valid and very pertinent question.
I just noticed there's someone from HSS here as well, and they have a talk for HSC students particularly coming up. If they could, or are they there still? Manjunath?
Yep, Manju is here.
Yes.
Yeah, could you just announce you are doing something for HSC students, I understand?
Yes. Namaste everyone. Like we supposed to have in last month, we're going to have some HSC career guidance program, because we wanted to have a physical program, but it's not happening, and we have postponed to some other day, and the date will, I think we may going to have in a Zoom activities, but definitely I'll let you know that this is the part of activities from HSS. The HSC students, they're facing like a stress on exams and all kind of things, because in the shakas, we have around 17 shakas in Sydney. In each shaka, we got 3 or 4 HSC students are there. They're facing so much stress on the studies. That's why we're going to have some program, but it's postponed. And we may go to, I think end of August, we may going to have some program in Zoom. Definitely, I'll let you know. Thank you.
Thank you, everybody. This was very useful and great chatting, and also meeting everybody after a long time.
Yeah, it's good to see people's faces after long periods of time during the week without seeing many.
And I encourage all those hiding behind non-videos to also put your videos on at some stage, so that all of us can see your faces and we see yours and say hello to everyone.
Actually, if you all don't mind, if you want to turn on your video, I can take a quick photo.
That would be lovely.
Or maybe we can wave or do a thumbs up or something like that. Something fun.
Okay. That's right. That's good.
Hold on one sec. So give us your best smile in 3, 2, 1. And one more, because there's so many of us, we cover more than one screen. And again in 3, 2, 1. The Jairam.
Nice one, Rajiv.
Beautiful. Thank you, everybody, and we'll see you next Sunday, same time.
Bye.
Thank you.
Bye.
Bye.
Bye, Auntie.
Thank you. Bye-bye.
Bye-bye.
Thank you.